The most important non-glycemic targets for the therapy of type 2 diabetes are the reduction of body weight, the prevention of cardiovascular and microvascular risk, and also the protection of organ function like renal function and the drop of blood pressure. Well, the cardiovascular outcome trials that have been reported that influence my practice are the LEADER trial for the GLP-1 receptor agonist liraglutide and the EMPA-REG outcome study for the SGLT2 inhibitor empagliflozin. And both drug classes are very important in order to reach the non-glycemic targets, as I have answered in the previous question. The impact of hormonal dysregulation in type 2 diabetes is that we also have very high glucagon levels in type 2 diabetes, and glucagon is the hormone that stimulates glucose production from the liver. Therefore, it is important to address hyperglucagonemia in the therapy of type 2 diabetes also as one of the glycemic goals. And the incretin-based therapies address this target very nicely and lower glucagon. The most challenging aspects of treating renal impairment in type 2 diabetes is that most patients who are diagnosed already have renal impairment at the time of diagnosis, and therefore we're running behind very often in treating renal impairment. It is a multifactorial treatment, and all the risk factors that contribute to renal impairment have to be addressed, and this is especially hyperglycemia and especially high blood pressure and dyslipidemia. The impact of treating non-glycemic targets is very important, because with that we probably can lower cardiovascular mortality. 2 studies have just shown this, as I mentioned, the LEADER trial and the EMPA-REG outcome study, and we will see more studies that are being finished now at the EASD in 2 days. SUSTAIN 6 will report with the long-term cardiovascular superiority of another GLP-1 receptor agonist, and other studies with other compounds will also be finishing within the next 2 to 3 years, one after the other. And we will also have more study data on the combination therapies with these substances that influence the non-glycemic targets, especially the combination of GLP-1 receptor agonists with SGLT2 inhibitors. Thank you very much.